Is surgery necessary for renovascular hypertension? Have you ever wondered if surgery is a must for renovascular hypertension? This type of high blood pressure is linked to narrowed arteries that supply blood to the kidneys. When these arteries narrow, blood flow decreases, prompting the kidneys to release hormones that raise blood pressure. The most common causes of this condition are atherosclerosis, which is plaque buildup in the arteries, and fibromuscular dysplasia, an abnormal growth in artery walls. Now, whether surgery is needed really depends on how severe the condition is and how well blood pressure can be managed with medication. Renovascular hypertension is one of the few types of high blood pressure that can potentially be reversed. Over the years, treatment methods have changed quite a bit. In the past, doctors would often remove the affected kidney, known as the pressor kidney, in hopes of curing hypertension caused by blocked arteries. However, this method frequently did not work and is not commonly used today. With the development of new medications, especially those that target the renin-angiotensin-aldosterone system, managing blood pressure with drugs has become the standard approach. Surgery or other procedures may be considered if medications do not control blood pressure effectively or if kidney function is significantly impaired due to artery narrowing. There are a couple of options available for these cases. One option is percutaneous angioplasty, which is a minimally invasive procedure. This involves widening the narrowed renal artery to restore blood flow. Sometimes, a stent may be placed to keep the artery open. Another option is surgical revascularization. This is a more invasive procedure that either bypasses or repairs the blocked artery. It is usually reserved for cases where angioplasty is not possible or has not worked. So, is surgery necessary for renovascular hypertension? The answer is that it is not always required. Most patients can manage their condition effectively with medications that control blood pressure and address the hormonal imbalance. Surgical procedures like angioplasty are typically reserved for specific cases where blood pressure remains high despite treatment or where there is significant kidney damage. The decision to pursue surgery depends on individual factors, the degree of artery blockage, and how well a patient responds to medical therapy.